Hello and welcome to this edition of A Conversation With. I'm Jim Marshall of the New Bedford Cable Network and her annual visit. It's time. We're talking bugs. Priscilla Matton, Superintendent for the Bristol County Mosquito Control Commission.
How are you today?
That's a long name tag.
It is. It is.
I was just saying this is probably the earliest we've had you in, but it's good to get it out there now because people. I'm noticing people with their signs, Mosquito, whatever company is taking care of yards. So it's certainly that time of year to at least start talking about this. And I don't think the peak, we always talk about the peak being like in September and stuff, right?
Exactly. Yes, we're just getting started. Usually by now, by the 1st of July, we have seen our first mosquito pool test positive for West Nile virus, but this year we have not seen that yet. But I expect it any day now.
Any day now, yeah.
Yes.
So Priscilla's been in it for a few years now, once a year, to talk about this and talk about the how serious this issue is and what we need to do to take care of ourselves and our family. I guess to start, and I know you always start this way, just sort of give us a general overall assessment of where we stand right now as we head into this summer.
So as we saw last year, right, it was very dry. We had the lowest populations of mosquitoes that we had collected since 2004. So we had very low mosquito populations going into the winter, which usually is a good sign for maybe lower populations coming out the following year in the spring. We had that very, very cold snap in February. Remember, that was, we think that's attributing to it, as well as the fact that we had the drought last year. So going into the season, in the early spring, we saw fewer mosquitoes of ones that we tend to see in the spring. We call them our spring brood. They only come out for a short period of time. Those populations were much lower. As we started to move through June, we're starting to see the populations go back to what we consider to be about average. So that's about a 5 or 10 year average, a little bit below that, but nothing significantly different. Is what we're seeing. When we're starting to look at the mosquitoes that are most important for disease risk, so for like Eastern equine encephalitis, those numbers are trending just a little bit down within Bristol County, but we are seeing slightly larger numbers, say within Plymouth County, which is our border, right? So we have to be very careful on what's going on there. And now, as we head into July and into August, that's when our mosquito populations for West Nile virus are going to be most impacted, especially with the weather we've just been having.
And it's funny because you think of, as you were just talking about, Plymouth County versus Bristol County. I mean, you're Bristol County, but it's funny, like when you talk to the people of Freetown or Lakeville, there's not much difference for them, but except for the county.
Exactly. Exactly. And that's why we pay particular attention to any traps that we have on our borders or any traps that the Department of Public Health might have within both of our counties to see what's going on, because sometimes there is a significant difference, and that's very interesting for us to see what is going on. Maybe it's those localized rain events that we've seen this past year that just might play that little bit of a difference between both sides, or even a different town.
You've talked about over the years here that we've done this together that things are cyclical too. And for a while when we first started doing it, we were up. But we've been on a downtrend the last couple years, if I'm not mistaken.
Luckily, yes. So for EEE, our last big outbreak, which was significant, was in 2019. Since 2019, Bristol County has not detected EEE again in mosquitoes or in any humans or horse cases. So that does follow the typical secular cycle that we do see for EEE, which tends to have about an active 3-year period, followed by a dormant sort of 5 to 7 year period. But it does seem a little bit odd not to find it at all, right? Because we are collecting a lot of mosquitoes, so we do expect to find it. And not finding it certainly makes us a little bit anxious, right? Because we can still have those pop-up cases that we didn't expect to find, because certainly it's circulating out in the environment. We just have to be able to find it. But certainly everything changes year to year. West Nile virus likes really hot, dry summers. It tends to keep the mosquitoes and the birds and the people all in the same area. This year it's been sort of spotty wet, right? Some areas of Bristol County have more rain than others. And so that might mean that there's localized risks that might be slightly higher than other places.
Talk about the impact of, and we've talked about this before, topography. Bristol County is a big area. And there's a lot of different, you've got ocean on one end and you've got swamps in other ends. So tell us the impact that that has on the mosquitoes.
So that's one of the things that we look at when we conduct surveillance. So surveillance is very important, and one of the primary focuses at mosquito control is to see what's out there, right? If you don't know what's out there, it's very hard to predict risk or to make pesticide applications. So you're right, we have these large cedar swamps that are very important for Tripoli activity, and those can be found really just right on our border of New Bedford and Freetown. There's Lakeville, of course, and then our main site is out in the Hockomock Swamp Complex, which is in eastern Rain and Taunton, so in the northern area of our county. But certainly we have salt marsh mosquitoes that can play an important role, especially for people that are trying to just enjoy some summertime activities. They can fly for miles, and they are voracious biters, and they come off in large groups, so you end up getting more than just a few bothering you at one time. But we have a wide variety, and that's what makes it important when we conduct surveillance. So because we don't find Tripoli, or we might not find West Nile virus throughout, say, the whole city of New Bedford, it doesn't mean that there's not a risk. It's just that we're looking for the specific disease or particular mosquito more in the area where we're more likely to find it.
And talk about, and I don't think people understand that, there are different species, if you will, of mosquitoes. And I think people just say, oh, it's a mosquito. So if you live here where we are in the south end, you've got the ocean, you've got a good sea breeze, so your mosquitoes might not be as active, I would say. And I would assume maybe then they're different mosquitoes. You were just talking about salt ones.
Sure. So we have 53 different types of mosquitoes in Massachusetts, and they feed on a variety of different things, from just birds, mammals, amphibians, you name it, they feed on it. So because of that, wherever you live might be slightly different, especially people around the coast. They can have salt marsh mosquitoes where we still can collect them up in the areas of, Dighton and Taunton, but they're not, as common. So we want to make sure that we're looking across the board. The mosquito that sticks closest to us, and we just kind of consider them living with us, so to speak, are those that use containers around our property. Those are really important for West Nile virus and just for overall comfort in your house. So one of the things we like to talk about is making sure that you're dumping your standing water.
Right.
We're going to have those mosquitoes that like permanent, clean, fresh, swampy waters and everything, and you can find those throughout the whole city. But then you're going to find those that are more interested in areas where, there's trash or plastic or catch basins along the road. All of those things are great habitats for mosquitoes.
And I would assume, too, that there's a difference, or there's an impact between the dry heat and the humidity that we're being encompassed by right now. I mean, it's been a string of just hot, humid, and last year was a dry heat. And I would assume that that's an impact, too.
Absolutely. So what ends up happening is all of this humidity that we have really makes great mosquito weather, right? So they're out almost all the time. I mean, if you're in full sun, you're probably not going to be bothered by them. But certainly if you're under your porch, and it's early evening, not 8 o'clock when the sun is really going down, but even around 5 or 6. I know I was sitting out on my porch yesterday and, it had just stopped raining, and I certainly had mosquitoes around. So this nice humid weather gives them the ability to sort of take advantage of more time, because they're not going to dry out as they would when it's hot.
Right. We were talking to Priscilla Matton from the Bristol County Mosquito Control Commission. I think what I probably should have done too is talk about the difference in what is West Nile virus versus Tripoli.
Sure.
And I think people don't know that difference, but there is a significant difference.
There is a significant difference. So Tripoli, Eastern equine encephalitis, exists here in Massachusetts as well as Rhode Island and a few other states. We had our last big outbreak in 2019. It is a very deadly disease, unfortunately, for us in Massachusetts, where well over 50% of the people who come in contact with it will unfortunately pass away. We do see that there are long-term health impacts, even though the symptoms are very similar, because they're both encephalitises, so swelling of the spinal cord, neck pain, fever, disorientation, those types of things. For some reason, Tripoli does impact us more significantly. We do look at it through a different group of mosquitoes than we do for West Nile virus, and it tends to be cyclical, and we have not seen it here again since 2020. But it's something that we're looking for, and we're certainly interested in what's going on outside of the state. So we do know that there was Tripoli activity in Florida and Georgia. We know it comes up in the birds, so these are the things that we want to watch out for.
So that's where it comes from, is from the birds.
Absolutely. So this disease, both Tripoli and West Nile virus, all require a bird host. So it's not people-to-people transmission.
Right.
A mosquito doesn't bite us and get Tripoli or West Nile and then pass it on to somebody else. It all revolves within the bird population. So these areas where the birds live, these swamps, or even in our own backyards where we have robins and such, these are all the areas. The birds become infected, usually in Florida, because again, Florida has a year-round mosquito problem. They fly up here, in the spring, and then they take roost, and then that's when our local mosquitoes can start to interact with them.
And Tripoli also impacts, obviously not really New Bedford, this impact, but those communities, the free towns, those who have animals, farm animals. You hear horses getting Tripoli and different animals getting it, so it impacts those things too.
Absolutely. Horses, alpacas, llamas, bird species like emus and ostriches, all of them pheasants can be impacted by Tripoli. So it's all something that we try to keep an eye on to make sure it's certainly a problem. Definitely talk to your vet if you have any of those animals and look to get them vaccinated.
Now we turn to West Nile virus, which is, as you said, there are similarities, but there are differences too.
Sure. So in West Nile virus, the majority of the people that get sick by West Nile virus have what they consider to be like a summertime flu, right? So they might have a fever, feel slightly under the weather, but maybe don't have any long-term symptoms. Of that, maybe 10%. Usually it's older, younger, immune-compromised people that tend to have these sort of, more aggressive symptoms. About 10% will show up with actually having, more of a case of West Nile that might bring you to your doctor. And then, unfortunately, on that 1% of them will or could get the neurological diseases. And we have cases every year throughout Massachusetts, so it's certainly something that's here to stay. It's not as cyclical as Tripoli is. We expect to find human cases here every year.
Talk to me, two things that I'm thinking of here that I wrote down. One, and I think we touched upon this last year, but I saw it again this year when I was looking at the state website. It used to be that southeastern Mass was obviously the hotbed, but it seems as though these diseases are now encompassing more of the state. Is that the case still that you're seeing?
We are. What we're thinking for Tripoli is that the habitat that Bristol County and Plymouth have, right? So our very old swamps, our Hockomock Swamp and, Carver Cedar Swamp, the Bolton Cedar Swamp here in the New Bedford Freetown area, they're an older swamp. Those swamps are now starting to mature out in Western Mass. So while they may have existed there, the natural cycle of how the trees have to, fall down and then, new trees come up, and the whole process of the swamp changing over, whether it gets more flooded or less flooded, all of those things are changing. So we are seeing Tripoli move further out into Western Massachusetts. So certainly a concern, and we can use some of the information that we've gathered here to, help out in Western Mass and see where that's going to be.
Do you see that, and I guess it's sort of a related question that I was thinking about, climate change. When you see these things happening, and I'm not just talking Mass, but in the Northeast, it's getting warmer. Do you foresee, or do you see like New Hampshire and Vermont, and even I guess some of the southern tiers of those states, are they going to be susceptible to this when they weren't for the longest time?
I think so, definitely. We tend to see Tripoli cases right along the New Hampshire, Massachusetts border along the North Shore. A lot of that, though, has to do with populations, right? So when we look at things like Maine and New Hampshire or even Vermont, right, there are large city centers and then large areas of, no activity or very
Right.
little human activity. Maine did do a study that was very interesting. They looked at blood from deer and moose that were collected during hunting season, and they were able to find AAA antibodies in their blood all the way to the tip of Canada.
Wow.
Yeah, so it is widespread. I think it's more to do with where the populations are, where the people are, and where we're getting our mosquitoes from. That's kind of giving us that information, right? So one of the things that we're looking to do in Massachusetts is to make sure we have more universal coverage of all mosquitoes throughout the state. So only certain towns within Massachusetts belong to a mosquito control district. Here in Bristol County, we have all 20, which make up Bristol County, but out west, not all of them are part. So we're trying to make sure that through the Mass Department of Public Health, they can start to do more testing to see.
I was going to say, you've done this for a while now, so you're not just the superintendent, you're an advocate too. Are you seeing more of a commitment from the state then to deal with this? Because it is, as you've said, it's not going away. So are you having to advocate to say, hey, look, there are other parts now of the state that are going to be impacted? I mean, and we're all tied to each other. We really are.
Yes.
I mean, it's usually, I know Plymouth County and Bristol County worked well together, but it's going to be more counties that are impacted.
Absolutely. And yes, the Mass Department of Public Health is working on getting the resources that are necessary to go out and do the surveillance, keeping in mind that we're looking for specific mosquitoes. And really, the risk is kind of low some years, right? So it is that whole needle in a haystack kind of thing. Certainly when we have big outbreak years, yeah, you can find it relatively easily. But it seems odd even for us here in Bristol where, we had so many positive mosquito pools in 2019, and in 2020 we couldn't find one. So those types of things make it very difficult. So we need to do, certainly what we need to do is what you said, risk on a bigger level, right? On a regional level.
I would imagine you're getting a lot of questions from outside of Bristol County, just because you've been around for so long to do this, the organization, and you've been in your position a long time too. People are coming to you looking for advice.
Yes, and that's, it's the same thing for other states as they're getting new species of mosquito, things that we might have here. We're getting new species of mosquitoes. We had discussed that Aedes albopictus, that Asian tiger mosquito that's been here in the New Bedford, Fairhaven, Acushnet area now since 2009. It didn't exist here before that. And, now we have an established population that we're trying to keep an eye on so it doesn't continue to expand. But that's what mosquitoes do. They move and they fly. And certainly there seems to be a change with temperatures.
We've talked a lot about the disease, but obviously there are precautions that we can take, and I know we talk about them every year, but it's good just to get the list of here's what we need to do. Obviously, the standing water is the big thing.
Standing water is the big thing, right? Because what is my saying? If you're breeding them, you're feeding them, right? If your water is right by your yard, because you're keeping that area for, your tomato plants to water them later, you have a rain barrel, you have buckets, you have that kiddie pool, maybe for your kids or for the dog, you're not dumping it out quite as frequently. Those areas are going to certainly get mosquitoes, especially when it gets hot and dry and humid like it is right now, right? So in this temperature, as we're moving in, right, maybe 90 today, and we're moving into July and August, in this temperature, we can go from an egg to an adult in like 10 days. So we really need to be, getting rid of that standing water. We want to dress appropriately when we can, long sleeves, long pants when we're outside. We want to avoid activity at dusk and dawn. Those are when mosquitoes are most active. And then we want to use a repellent that's approved by the EPA. So things like DEET, picaridin, oil of lemon eucalyptus, those types of things. Read the label, find something that works for you.
I was going to say, there's a lot of, you read a lot of stuff about repellents, like what, and really there's not, you see a lot, but there's really only a few that really are approved or really what you recommend when you come on.
Exactly, right. So we recommend the ones that have been tested and looked at through the EPA and are recommended also by the CDC for mosquito. And, DEET, picaridin, oil of lemon eucalyptus, IR 3535, which is the active ingredient in Avon Skin So Soft, right? We've heard about Avon Skin So Soft for so long. You got to buy this specific one that says mosquito repellent and has the active ingredient.
What about for kids? Same thing?
Sure. You don't want to use oil of lemon eucalyptus on young children. You don't want to use DEET on any child under 6 months old, but you can do other things for them, right? If they're, say, in a stroller or something, you can use a net. You can avoid those types of activities. Be careful, right? Because as we get into the fall, which I know we're not thinking right now, but leaving the door open to let the dogs in and out, right? Or leaving the slider open as the kids are running back and forth in and out of the pool or something. All of those are ways for mosquitoes to get into our house. So we want to keep our eyes, make sure our screens are covered, make sure that our doors are closed, make sure those things are getting done as well.
And it's really good right now, just the preventative stuff, because if you were just alluding to, I mean, when you get to late summer, early fall, when it's really peaking, I mean, you've been on the show and we've talked about, like, there have been schools that have canceled sports because of the threat. Again, we're not there yet. We're still in the middle of summer, but it's good to take the precautions now, because if you can limit it, I would assume it's going to make things a little easier come September.
Absolutely, right. Anything that you can do now, because we do get cases this early. Yes, they usually peak in August, September, and sometimes into early October, but you don't want to take any chances, right? You don't want to be the one that happens to have the first case. So anything that you can do to avoid mosquito bites is very important.
Got a few minutes left. I want to touch on something that you and I were talking about off camera, but just because I saw it on the news and how and you explained to me the difference, but I just want to, for other people who saw it, you have malaria in mosquitoes down in Florida and Texas. Again, totally different climate, I understand, but I was just surprised to see that. And you were explaining, and you were explaining to me about how that works.
Right. So it's definitely a different disease. So for West Nile and Tripoli, you need the bird. For malaria, it's human to mosquito to human transmission. So if you get enough people into an area that have malaria, right, so they traveled somewhere that malaria is endemic, and then they come back to wherever they live, and then there's mosquitoes present in that area that are a competent vector, right? So a vector that can pick it up and then transmit it back on. You can have localized transmission. We saw it a little bit, down in Florida during the Zika outbreak.
I remember that, yeah.
Yep, and then maybe you remember that in Miami they had a couple of locally acquired dengue cases, which again is a human to mosquito to human transmission. You just need the right mosquitoes and enough population with enough people that have it. So it's certainly something that was very interesting, because we had eradicated malaria from the country. So yeah, it's definitely something
and it was a few dozen cases too.
It has been a few cases, yes. Yep. Once it gets going. It wasn't that long ago that, believe it or not, there was a locally acquired malaria case right around Washington, D.C. and Virginia. It was because enough people had come back. Yeah. So it usually burns itself out, once people start taking precautions of not getting bit by mosquitoes. But certainly also important, that brings up a good point though, Jim, is that you're traveling, right? Where are you traveling to? You could be traveling to the Caribbean, you could be traveling to Texas, you could be traveling to Florida, you could be traveling, across the ocean. You want to, be aware of what's going on there and make sure you're taking those precautions so you don't bring anything back with you.
I remember that Zika was tremendously scary.
Exactly.
A lot of people. I know you're not the expert and you're not monitoring this, but I just want to touch on the ticks. And I was reading that the situation for ticks, it's a above average year, it seems like. And there are, people are concerned. And again, I know this isn't, but I know you can at least issue some commentary and some warnings on how people can take care of that too.
Sure. So what you want to do for ticks, right? We know we have them here. We have a very high percentage of Lyme disease in our area. We want to definitely make sure we avoid tick bites when we can. If you find a tick on you, you want to remove it as quick as possible. Use tweezers, pull it right off. You can save the tick by putting it in a plastic bag in your freezer. Maybe write down where it was on you, who it was on, when you took it off. Maybe you remember where you were, maybe you don't, but this might help you if you get symptoms further down the road, right? If I asked you, hey, where were you 2 weeks ago? You're like, I don't really remember. remember, right?
Yeah, exactly.
You know, oh wait, was I cutting my grass and I brought those lawn clippings way into the back of the woods and brushed up against all of this, you know, different material, you know, you may have been able to come in contact. So a lot of the same preventions that you can use for mosquitoes work for ticks. So you, if you're going to be out, long pants, long sleeves, you can use DEET. It works against.
Oh, does it? Okay.
Yep. There's also other products that can be used, like permethrin, which goes on your clothes, not on your body. You can buy that in the camping section. You can buy clothes that's impregnated already with it, and you can wear it when you're going to be doing those things that you think you're going to come in contact with ticks. Keep an eye on your dogs and your cats, right?
Animals, yeah.
Yeah, because they can just bring them into the house and then you might not know. But say you're going to go out and you're going to go hiking, you want to stay on your trail, try not to brush up against the sides too much, stay on the trail, stay in the middle, check yourself, certainly do a tick check every time you come in. And then if you have clothes that you're wearing, throw them in the dryer, you know, on high heat for like 10 minutes. You don't have to wash them just yet. Throw them in the dryer and then leave them in your hamper. But, you know, if they're on your clothes and you're just throwing your clothes in the hamper, yeah, they could get out and, you know, you might have a tick in the house that you might find a couple of days later.
Is the tick population related to, in a sense, like the mosquitoes' weather?
Certainly, yeah. But what we think is that for the deer tick, it's very much related to acorns.
Really?
Yes. So there seems to be some, and so now deer ticks take a 2-year cycle. So they hatch from the egg and then they become a nymph. They become a larvae, then they become a nymph, and that's usually within the animal burrow. So things like small woodland creatures is what I like to call them, you know. But that could be in your stone wall or in your wood piles, things like that, right? So where you might have contact with them. The following year, they become adults, and that's when they kind of go on bigger hosts, so things like deer. But they'll still stay on things like rabbits and chipmunks and squirrels and stuff like that. What ends up happening is all of those small, you know, like squirrels and things, they like acorns. Right? Mice like acorns. So when you have a nice acorn population, which happens in the fall, right, then you build up your mice population, your squirrel population, all of these things, because they have lots of food, giving lots of area for those ticks to then use. So it tends to be, if we see a good acorn population, then we get a good bounty of those kinds of animals that eat it.
So the dryness doesn't affect it either.
No, I mean, sometimes there are things that can impact oak trees, certainly.
Right.
But, you know, yeah, more or less we're talking about something more of a food source, and then those abilities for those small mammals like white-footed mice and stuff like that, yeah.
Wow, I didn't know that. That's interesting. We got a minute left. I want to make sure that you get time to plug the website and all. I mean, I've been on it. Lots of information on there, and the state website is good too.
Yes, absolutely. Always check out the Mass Department of Public Health. You can find any information there. You can just search them by mosquito, mass.gov, you know, and search mosquito. You can find us at Bristol County Mosquito Control through the mass.gov website. You can call us at 508-823-5253, or you can send a request to requestbristolmcp@comcast.net. And you can find all of that information also on our website.
And you're spraying too.
We are. We have not had as many mosquitoes, you know, as we usually do. Our trap numbers are a little bit lower. Our spray requests from residents are certainly a little bit lower. So we're maybe not as visible as we are sometimes. But I do expect, you know, coming the next couple of weeks of July with this heat and the humidity and the rain that we have gotten, you could see us around a little bit more. But we are working with the health department and the mayor's office to take care of the parks here in the city of New Bedford.
Yeah, you always have, yeah.
Yes.
It's great seeing you again. Lots of information.
Yes.
I appreciate it.
No, thank you.
Priscilla Matton, our guest. I'm Jim Marshall. This has been A Conversation With. Thanks for watching it, and we will talk to you again soon.